Dr. Nill from Nill Chiropractic joins us here on Insight, and it's good to have you back.
Hi, thanks.
So you've got me again, when you come in, you bring this device, which is doing what? Because it always just makes my hand or wherever you put it feel warm.
This is a system called Anodyne Therapy, and what it does is it emits monochromatic near-infrared light, which is a special light wave, 890 nanometers, that stimulates the release of nitric oxide. And what that does, it actually
Promotes healing, doesn't it?
Yes, it actually opens up the blood vessels and increases circulation to the area, which in turn promotes healing. It affects helps with pain, muscle spasms, and circular issues.
So again, all it's doing to me right now that I feel is warming, both sides of my hand. But it's getting into parts of the muscle that normal, I guess, treatments wouldn't, right?
Yes, it's what we call working at the molecular level. So it's working on the outside in with the heat that happens with the light bulbs after time. But the best effects is what's going on at the blood levels itself.
So who would be a good candidate for this?
Well, it works really good with people that have post-chemotherapy, diabetes, acute injuries, poor circulation, post-alcohol neuropathy pain, pretty much anything where you have poor circulation, acute injury, pain, swelling, wounds. The effects are endless.
The typical treatment is going to take how long?
Okay, so we usually use 45 minutes sitting on the machine, and then we do about 15 minutes of exercises and whatnot. So.
Yeah, and I would think the response, would be pretty immediate, because I can feel it's already, going to work.
Yes, it takes a little bit of time to get things to really work in there, but the post effects last even longer. So we've had up to 1,600% increased circulation for up to 4 hours afterwards.
That's terrific.
Yeah.
So if people want to find out more about this, obviously you've got a lot of information on your webpage.
Yes, you go to nillchiropractic.com. Everything's on there. You can also go to the Anodyne Therapy website, and you can get all the clinical research and everything you need from there too. So everything's available to the public, and it's really cool. The technology was actually started. NASA figured it out when they were up in space, and they were doing experiments, and then now they use it in a lot of the government settings, hospitals, and physical therapy offices, chiropractic offices. So
yeah, I'm thinking someday we got to have you put this somewhere like on my shoulders or something where, because my hand's feeling fine before we started.
Yeah, the cool thing about it is they actually have another unit too that we use for low back problems, but this is portable. You can put it about anywhere. We just get creative with the straps and whatnot, and the things are endless. And it really works well too with somebody with plantar fasciitis and diabetic neuropathy. It's about 90% effective for patients that have diabetic neuropathy. So all that neuropathy pain, we can actually reverse the symptoms and prevent any type of future damage. So it's not masking anything. It's actually healing and correcting the problem.
And with no side effects.
There's no side effects.
This is the safest thing you could possibly do. It's light.
That's right. The worst case scenario, if it got too hot, it might cause some burning. So we have to check on that every 5-10 minutes just to make sure everything's good, because some people don't have enough sensitivity in their feet. So.
Got it. All right. Well, if you'd like to find out more about the Anodyne Therapy here that Dr. Nill is demonstrating, kind of like this, go to nillchiropractic.com or check them out online, or give them a call at the number on the screen. We'll be right back on Insight.